Well, a very warm welcome to the United Against Rabies Forum annual meeting. This is the second of 3 webinars that you are conducting to bring together all those who share our goal of eliminating all human deaths from dog-mediated rabies by 2030, which we call 0 by 30. I hope you enjoyed your first webinar last week on rabies, One Health and COVID-19, which will be available on YouTube if you missed it. My name is Dr. Thumbi Mwangi. I'm a veterinarian and infectious disease epidemiologist from Kenya, working with the Allen School for Global Health in Washington State University, the University of Edinburgh, and primarily based at the Invito Nairobi Center for Epidemiological Modeling and Analysis. Together with my colleague Ryan Wallace from CDC, I co-chair the United Against Rabies Working Group, one which is focused on vaccines, tools, and technologies for effective rabies control. Our work aims to catalyze the elimination activities by harnessing vaccines, medicines, tools, technologies to make 0 by 30 a reality. We are now less than 9 years away from this target. There's not much time left. Luckily, we have most, if not all, the tools to win this battle, to stop all human deaths that come from dogs from rabies. This webinar is about some of these necessary tools. We'll be presenting some of the work that we have done as Working Group 1 for the last 1 year. We warmly invite you to send in your questions using the question and answer function. But before we dive into the details, let's see what we can learn from other ambitious disease control programs that have been successful. 10 years ago, the world was declared free of rinderpest, the first animal disease to have been eradicated in the history of mankind. And you're very fortunate today to have Dr. Peter Roeder, one of the leading lights of the rinderpest campaign. He will be speaking with Dr. Bernadette Abela-Ridder, team leader of the neglected disease, zoonotic diseases at the World Health Organization. Over to you, Bernadette.
Thank you, Thumbi, and hello and welcome, Peter. Of course, we go back a long time when you were my supervisor and mentor at the Food and Agricultural Organization, Tanti Anifa. And one thing I really learned from you is the perseverance. I get the inspiration for trying to find creative solutions to complex problems that at the onset seem insurmountable. So as Thumbi mentioned, you are recognized around the world for your leadership in the campaign to eradicate rinderpest. And you have come here today to share some of the lessons you have learned in that process in case they're applicable to rabies. Peter, welcome.
Thank you very much. It's a great pleasure to be here. Thank you very much for inviting me.
So I guess let's start with the basics. Can you give us a little brief around rinderpest and why was it such a concern?
Yes, I can, sure. I'd like to say, first of all, that looking at United Against Rabies, it's impressive to note the progress that's been made in such a short time. If I seem to be critical at all in places, please view this as constructive advice. I don't want to be critical of the impressive team that you've assembled and the work that's being done. So you want to know about rabies, about rinderpest. Rinderpest is a morbillivirus disease, which is known for millennia and was present all the way from the far east of Asia to the west of Europe. And in the last century and a half down to the south of Africa. It was highly contagious and was capable of producing high mortality rates, up to 100% even on some occasions. So it was so severe that whole areas of the world were denuded of cattle, and it was devastating for livestock farmers. It was one of the things that led to the downfall of the regime in France and in other countries. So it was an extremely serious disease. So it's now farmers recognize, well, those that remember the old days recognize how much better off they are, particularly in Africa.
Thank you, Peter. And I guess the big difference between rinderpest and rabies is a zoonosis, and rabies does not travel as much as rinderpest did, I guess, in crossing borders. So what would your advice be as we work towards stopping human deaths from canine rabies, as we try to reach our first target of 0 rabies deaths? And of course, knowing that the next target will be breaking transmission in dogs. Where would you start, knowing that this program is under-resourced, often not prioritized as we would like it? So where would you start?
Well, my approach would be to control the dog-to-dog transmission, because I think that's the best way of stopping the human deaths from this disease. And for me, concentrating on epidemiology and surveillance is of paramount importance. It was in rinderpest. We did not really start to eradicate rinderpest until there'd been big steps forward made in the epidemiology, understanding the epidemiology of rinderpest. And I think second to that is being innovative. I mean, I would stress surveillance, as I've said, and surveillance tools. I mean, you could do, I think, or you could make much better progress if you had a very good tool for the pen-side diagnosis, as it were, of rabies. You need, like we had for rinderpest, something that field workers can use and can immediately be assured that what they're looking at is rabies. These issues made a big difference in rinderpest eradication. Together with vaccine quality assurance, we had a big problem to start with rinderpest vaccines. Something like 90% of vaccines at the start were found not to be fit for purpose. And once we got on top of that, working with AU-IBAR, the African Union IBAR, into African Bureau of Animal Resources, establishing a vaccine quality assurance laboratory, and then getting agreement from countries that only vaccines which were assured efficacy were used. And that was extremely valuable. You don't have any such mechanism for rabies, I think.
For dogs, less so, but we have a vaccine bank. But for the human rabies vaccines, we do have a pre-qualification program that assures countries that are procuring the vaccine of its quality and safety. Yeah.
We had thermostable vaccines as well, which proved to be extremely important when we had teams vaccinating in the field, vaccinating cattle. And yes, I mean, those issues with vaccines are, I think, quite important. But I've been wondering whether you couldn't make more use, I like to keep saying, be innovative, whether you could make more use of bait vaccines to intensify the vaccination of dog populations and wildlife, perhaps at the same time.
And you actually bring up a very important topic in the sense, we always say that the bait vaccines would be a supplementary tool to a dog vaccination program for multiple reasons, because the vaccination by needle is often easier and less expensive. And it's not as easy as we think that we just throw out the bait and the dogs vaccinate, it's a whole science. And we have our WHO collaborating centers, OIE, working on finding the best sort of scale up of this, of using baits, especially in those communities where dogs are difficult to reach. So, but you bring up a very valid point, and there's a lot still to be understood. And we do have Ryan and Thumbi and others on this call today who can actually answer the more nitty gritty on the bait vaccines, but you bring up a very pertinent subject.
Yes, to me, this relates to focusing, which is an issue we'll come to a bit later, is the need to focus on exactly what it is you intend to do. And focusing in this sense, I mean, that rabies will not be everywhere, just like rinderpest wasn't everywhere. But we were hamstrung to start with because everyone thought, right, we have a disease, it's everywhere in the world, we need to vaccinate every animal in the world to stop the disease. But once we realized that it wasn't so, and that in fact there were transmission hubs, as it were, for virus, and once we recognized that and worked out how we could detect them and then focused control on those areas, that was when we started to make big progress. In fact, that was the essence of the intensified global rinderpest eradication program, which started in 1999. And in fact, the last case of rinderpest was probably in 2001. So it took just under 3 years to actually eliminate the disease once we started focusing properly.
Thanks, Peter. And those are truly important sort of guidance that you give us, which we are trying to translate into practice. And you bring up a really important point around surveillance. And in fact, rabies data is weak. It usually occurs in disadvantaged populations where systems do not reach them. And often the surveillance systems are not linked up across sectors. So we do miss a little bit of the picture. But one thing that was a very strong area for the rinderpest program is using participatory mechanisms for surveillance. What would you mean by that, and how would you go about it with regard to rabies?
Yes, I agree, that's extremely important. What we mean by participatory disease surveillance is actually accessing the intelligence of communities of people. They know a lot about the disease that we don't. And we need to access that information that they have. And their memories go back a long way. And they will tell, did the disease occur all the time? Did it occur in waves? If it did, where did it come from? And we learned a hell of a lot about rinderpest from talking to communities like that, particularly towards the end, because this is essential if you're going to verify freedom from the disease. And for example, in Pakistan, we conducted interviews and community interviews in 10% of all of the villages in Pakistan. That was well over 2,000 villages. And by doing that, we were able to show where the disease was, and then later to show that it wasn't there anymore. And so that participatory approach is extremely important. We had rinderpest officers appointed, people in the remote areas who could go from community to community and provide this community intelligence about disease. And that was a very useful adjunct to other surveillance systems, because I think your situation would be the same as ours was, that surveillance hardly exists in much of the world where the diseases are most prevalent.
Thanks, Peter. Yes, it is one of the areas we will be trying to really focus in on in the upcoming months with the support from different stakeholders to try to not only build that community aspect, but also to bring together the two sectors so that we are bringing that knowledge and evidence together. But you bring up, yes, go ahead, Peter.
Stress one thing.
Yes.
We had problems with people conceiving what we mean by participatory disease surveillance. We don't mean having a formal questionnaire which agents go to a village and then fill in all the questions and come away again. That's not what we talk about. We mean actually communicating with the communities and empowering them to tell us, not just by questionnaire. Okay, sorry, I interrupted you.
No, but I think you're quite right. And we do have expertise on the United Against Rabies Forum that hopefully will bring that as we work towards improving data and surveillance. But perhaps one last question, because it's something that really is what we try to do by setting an aspirational goal of 2030 to reach 0 rabies deaths. You talk about focus. What is your message here?
Well, there are many different aspects to focus. I mean, one of them is to maintain your emphasis on eradicating or eliminating infections in humans from dogs, which that is focusing in itself, and that is very important. We had a lot of problems with keeping focus on rinderpest eradication because many people wanted to extend what we were doing into strengthening veterinary services and all that sort of thing, and bringing in other diseases, and that would have been ruinous for us. We had quite a lot of problems maintaining our focus in that direction, but we did. And of course, one of the reasons people were saying that we had to bring in other diseases and other things is that they wanted to develop veterinary services. Now we say, and our experience is that you develop veterinary services by having a program in place that people are following, and they build up their expertise that way, not by diversifying the program into other areas and specifically not into strengthening of services.
Thanks. I think we could have a long conversation about this, Peter. I guess rabies can contribute as a sort of an indicator of progress of both veterinary services and reach of human health services as well. So with building a rabies program, you can build the systems and the workforce who get reprogrammed during pandemics. And we could argue about this. I think probably communities would also appreciate not only looking at their dogs, but at their wider problems. So finding a balance there would probably have to be what we do. But I thank you for that inspiring conversation as always, Peter. And I will now hand over to Thumbi, who was introduced earlier, and to Ryan, who's the veterinary epidemiologist at US CDC.
Thank you.
Thank you very much.
Thank you, Bernadette and Peter. My name is Ryan Wallace. I'm a veterinary epidemiologist at CDC, and I lead our rabies epidemiology program. So about a year ago, Thumbi and I were asked to assemble a group of experts on tools, vaccines, technologies to address rabies, and specifically for the 0 by 2030 goal. And I'm happy that for the next maybe 45 minutes to an hour, we're going to share with you some of the progress we've made over that last year. I think as we've all experienced, it's been a challenging year to accomplish anything besides COVID-related activities. And a lot of the experts we have assembled, not only worked on rabies over the last year as their core duties in their countries, but they worked with us on the United Against Rabies objectives, and they also were largely pulled into COVID control activities in their own countries. So it's been incredibly busy, but we have made some pretty big strides despite all of the challenges. The other thing I think is really impressive with this group, and I'll share right now who that group is that a lot of us have never even met each other. We've been doing this entirely remotely because of obviously COVID-related issues. Now everyone should be able to see my screen, correct?
Yes, Ryan.
Yes.
Perfect. So here I'm just flashing some of the names that are either part of our core group with Working Group 1, or they've been incredibly helpful in participating on our specific activities. You can see we've got in red there the countries that they represent, and well, it's a relatively small group right now. That is by design because we wanted to get a couple of quick activities accomplished. But this work group is open to anybody who wants to participate. And actually a lot of people that are helping with the materials you'll see later this morning go far beyond who's listed on this slide right here. We're going to hear 3 specific talks right after I'm done talking here. That'll go into detail about our first 3 activities. But I want to give a quick overview because we've got a couple of activities that you're not going to hear anything further about. They're a little bit newer. The first one is minimum data elements. And like Peter highlighted, data and surveillance is incredibly important. Otherwise, you can't tell if you're doing a good job. do an intervention and you don't track that intervention, you can't say it's successful. So one of our first objectives is to address the really, honestly, really poor data quality across the globe as it relates to canine rabies. You will hear about a 15-minute talk on this in detail next. So I'm not going to spend too much time on this slide, other than to say we're trying to identify the key data elements at that international level that will hopefully provide some framework for national and field level standardized data collection. The second objective for our working group, you will also hear a talk on this one, is about tools. Like Peter mentioned as well, tools are incredibly important to address this global issue. And for about the last 5 years, there have been a lot of tools developed and implemented for rabies, but not in a coordinated fashion and not in a way where we feel like everyone has access to those tools. And so this working group has been trying to identify those tools and find a way to make sure people can understand what they do and where they're best used and how you can access them. And we're going to hear about this in detail in just a few minutes. And then the third talk you will hear about is on mapping rabies activities. And this has been an incredible challenge because as we've made clear, data is not very good for rabies right now. And it's hard to map things when there's very poor data. And so you'll hear a bit from Terence Scott from Global Alliance for Rabies Control about those challenges. This is one you're not going to hear about today. Hopefully later this year or at our talk next year, you'll hear about some great progress, but this is a brand new activity that our work group has decided to undertake. And it's looking at trying to improve dog identification as a way of improving that human-animal bond. And so we've got a group of experts on animal welfare, vaccines, and tools that are looking at that pharmacoeconomic model. How can our vaccine manufacturers help also not just deliver vaccine, but improve the ability of our vaccination campaigns to reach their targets, dogs, and make sure people know that a vaccinated dog is a protected dog in their community and actually helps their community out. So they've got some really ambitious plans to try to test out some new ideas. We hope that will start being implemented in the next few months here, and we'll have some really exciting information to share soon. And then the last activity that this group is undertaking, which I think Peter highlighted very nicely in his discussion earlier, is looking at rapid diagnostic tools, rapid diagnostic tests. Picture like a bedside test in a hospital, or in this case, a field side test where you can tell if an animal has rabies right in the field. You don't have to send it to a diagnostic lab, where in many countries, there might only be one that can perform our gold standard diagnostics for the whole country. That clearly limits our ability to engage the field level and to get good surveillance information. And so we have a group of experts that are reviewing the current evidence for rabies diagnostic tools, and then looking to evaluate costs and benefits of implementing these types of diagnostics. The activity will not be talked about any more than what I'm sharing here, because this is also a brand new one, but in the next few months, activities will roll out and we'll have some really exciting updates later this year into next year. And just a quick glimpse at these, the idea is that you literally have almost like a pregnancy test. I think more people are probably familiar with those than rabies lateral flow assays, but you just need to get some antigen on these little kits that are very temperature stable. And from that antigen, you can tell if the animal had rabies or not. I want to preface this with evaluations have been done in the past and they've been very inconsistent. And so we're hoping that some new advances in this technology are going to lead to a tool that we can, as UAR, WHO, and OIE, can really rally behind and say that there is a reliable tool that can be used in the field. So that's the goal of this group. So that's all I'm going to say about what our scope of work has been. You're going to get about 40 minutes of detailed presentations coming up next. So as soon as I'm done talking here, you're going to hear 3 pre-recorded presentations. The first one is going to be from Terence Scott, Global Alliance for Rabies Control. He's going to talk about mapping. Then you're going to hear from me again with a recorded presentation on minimum data elements. And then lastly, you'll hear from Shadomy of FAO on the tool, the tool evaluation activity. Shortly after that, we'll have time for questions and answers, and please log your questions in the chat box. We'll be monitoring that as well. And with that, I'll turn it back over to the coordinators to start sharing the videos.
Good morning, good afternoon, and good evening, wherever you're joining us from around the world. I'm Dr. Terence Scott, and today I'll be presenting on behalf of the Mapping Workstream, who will be telling you about the global rabies map. So for rabies elimination, we understand that collaboration and coordination are absolutely essential to achieve rabies elimination. And we know that different stakeholders, whether they are stakeholders at the national level within the country, at the local level, or international level, need to work together to achieve rabies elimination. And this brings in the One Health concept in terms of bringing together all the different partners and all the different stakeholders to work towards a common goal. Importantly also, to achieve rabies elimination, we need to understand the situation in the country. We need to understand, as an example, what tools are being used within the country and which tools are best fit for purpose. We need to understand which partners are involved in the country. And again, these are partners within the national government, but also international partners and local level partners who may be non-governmental, but who are supporting rabies control and elimination efforts. And we need to ensure that those partners work together to achieve elimination. We also need to understand what data is being collected and how this data is being used effectively to make decisions about rabies control and elimination. And of course, importantly, we need to show the progress that is being made within the country. So each of these 4 points that I've just mentioned form part of different working groups and work streams who are developing these different aspects. And the idea behind the mapping work stream is to try and bring together all these outputs and results onto a single map so that the information can be found and can be used effectively so that we can drive this collaboration and coordination. So the global rabies map, as I mentioned, will really focus on fostering collaboration, identifying which partners are working where and in which countries. And this is to improve the coordination between partners within the country, but also to improve coordination from the international level, as an example, to show which partners are working in the country and how those can best be supported or supplemented. Maybe if there are multiple partners working in the same country, they may not be aware of the work that is being done within that country by each of these partners. And the idea behind this map will be to highlight that the work that they are doing within that country, and so that the progress and the efforts can be coordinated rather than the different partners working against one another. Importantly, we need to identify the needs of the countries. And again, as I mentioned, this forms part of another working group and another work stream. But we want to highlight what the countries need in terms of progressing towards the 0 by 30 goal and progressing towards dog rabies elimination. So if countries and governments can identify what they need and what support they need, then international partners, other stakeholders, and potentially even donors can look at this map and highlight where they can best support different countries in terms of addressing their needs. And this ties in obviously with the support, looking at where we can best support the different countries in terms of what they need, but also supporting the different partners and stakeholders to achieve rabies elimination through coordinated efforts. So the implementation of this mapping workstream, it is in the very early stages of implementation, but it will be developed in a phased approach. And the first phase will be to map where the UAR forum members are working. And as I mentioned, this is to improve coordination between the UAR forum members and the governments. So to ensure that the country-centric national strategy is being supported by the UAR forum members, and that the rabies elimination efforts are continued to be driven by the governments. And it's also to then improve coordination between the international stakeholders, and this also helps to identify countries where there is no or limited support. And this aligns with the Global Strategic Plan second phase, which is the scale-up phase, in terms of scaling up efforts towards that 0 by 30 goal. So I'd like to thank you very much for your attention, and please keep an eye out on the UAR forum for any further progress or updates about this work stream. Thank you very much.
Hi, my name is Ryan Wallace, and I'm going to talk about one of the core activities that Working Group 1 has been undertaking over the last year. Again, Working Group 1 is looking at the effective use of vaccines, medicines, tools, and technologies. And one of our initial objectives was to improve the data around rabies globally, especially data that will help us understand if we're progressing towards the elimination of dog-mediated human rabies deaths by the year 2030. And so one of the first activities we undertook was trying to understand if there is a clear set of minimum data elements that we can provide to all of the countries, rabies endemic countries in the world, and help improve both a standardized and more robust surveillance data collection system. And so for the next about 10 minutes, I'm going to talk about what our working group has been undertaking and some of the exciting developments that we hope will be coming out probably in the next few months. So minimum data elements, or I'll call them MDEs, they exist at multiple levels. And depending on what level we're talking about, different types of data might be collected. So at the field level, when someone's going out and investigating a suspect rabid dog or a human that has rabies, there are a lot of data elements that might need to be collected. And then there's some filtering. Some of those will be very important for the national level to collect and make sure that they're monitoring. And then at an even smaller level, at the international level, there's certain data that's going to be very helpful in understanding the global burden and our progress towards certain global indicators. To give an example of this, again, there's a lot of data out there. We can probably come up with thousands of things that would be very interesting to collect during rabies investigations. But there's some minimum set that's going to be collected under most programs at that field level. And so that data is going to flow in at the field. And then some of that data is going to move on to the national level. And then an even smaller amount is going to move on to the international level. For example, if we look at history of vaccinations, so say someone's been bitten by a suspect rabid dog and they need to go get their post-exposure prophylaxis, the common question at the field level to ask, have you been vaccinated for rabies before? So if we look at this data element, potential data element, it's incredibly important at the field level because it's going to be very important for deciding what type of treatment that bite victim is going to get. However, at the national level, it's not really clear how that piece of data is going to be very helpful. Maybe to monitor how much PEP is being used in the country, but it's probably not a really important national level variable. And at the international level, it really serves almost no purpose. There's really almost no reason to collect this information at the national level. So this is an example where there's a lot of data at the field level, but that's not necessarily what the national or international communities need to be collecting. Another example, the test result, the rabies test result, let's say for a biting dog. Clearly at the field level, it's incredibly important because that's going to tell us whether or not that bite victim needs to get post-exposure prophylaxis. At the national level, it's also a really important variable. It helps us understand the rabies incidence rate in the country and also the efficacy of any interventions like dog vaccination or maybe an integrated bite case management program. And at the international level, this is probably also a very important data element to help us monitor progress towards rabies freedom and estimate the global burden of rabies, globally. And so we had to decide as our working group whether we were going to try to tackle all three of these levels, just field, just national, or just international. And since this is really our first big objective that we're undertaking as UAR's Working Group 1, we decided we're going to start at the highest level and hopefully the easiest and fastest to get a good product out. And so we are tackling the minimum data elements at the international level. Now I want to point out there already is a very robust, really amazing data repository for international health data, and that's the World Health Organization's Global Health Observatory. The Global Health Observatory collects data for numerous diseases, numerous health conditions, and for some of these, especially the bigger diseases, they have incredibly robust data where they're tracking every year case rates, changes, interventions. It's really an impressive system when the right portals are developed and our countries participate and share that data. Now, this is an example of a neglected tropical disease that is in the Global Health Observatory, and it's leprosy. And what you can see here is that leprosy has 9 different data categories. I think they collect quite a bit more data, but they display 9 different data categories. So you can go in and click on each of these and see this data for every country that participates. And also point on that little box there on the right-hand side of the screen, they've got just some really nice aggregate values about the burden of this disease regionally and globally. Now there is a rabies portal in the WHO Global Health Observatory, but it's very bare minimum and there's very poor participation. So right now there's only one data category that is displayed by the Global Health Observatory. And if you look at that little box on the right, there's no data on the global burden. And if you look into the data a little more closely, it's very spotty. Very few countries participate. Very few cases are both detected and reported. So while the structure is there for an amazing international data repository for rabies, the data does not exist in most countries. It's not being collected, collated, or reported. And the portal itself still needs quite a bit of work to make it robust. And so that's where we're hoping our minimum data element activity within United Against Rabies will be very helpful. So how do we tackle this? Well, we got our group of international rabies experts together. These are all core members of the UAR Working Group 1. And we did a landscape analysis. So we looked at all of the different guidance documents that talk about standard data definitions that we could find. And we found 12. And these spanned European and US guidance documents. They're very robust, but also a lot of guidance documents from PAHO, OIE, Global Alliance for Rabies Control, and WHO. After we reviewed all of these guidance documents and compared them, we identified 6 data element categories shown there in the pie chart, and we identified 61 minimum data elements that were present in these guidance documents. And so that was our first layer here. So what even exists? And how many data elements are we talking about? And so that number is 61 to start with. Like I said, the WHO Global Health Observatory, while not many countries participate in it, they do have a list, and they have 107 minimum data elements. And so our next step was to compare the United Against Rabies data elements to the WHO Global Health Observatory data elements. Now that little band that you see there in the middle of the screen looks almost like DNA. It's just a visual representation of how well these aligned. And so if it's red, they were completely missing from one or the other UAR WHO lists. And if they're blue, they were found in only one. And if they're green, there was almost a perfect match between what UAR said and what WHO already had. And so if you look at this, this DNA strip almost, the alignment's about 62%. So for a completely independent process, both of these groups came up with relatively similar critical data elements to report. So when we merge all of these data elements together, both from the WHO Global Health Observatory and the UAR data elements, we end up with 96 key pieces of data that should be important to track at the international level. 72 of these we consider core. They're probably data that's going to need to be updated every single year. But 24 of them are pieces of data that probably don't change very often. And so we call that a country profile. You'll enter it once and update it as things change, but they won't likely change year to year. And then we finalized it as 5 different categories. So we have a category of human rabies cases, and there are 18 core data elements in that category. Then we have bite cases, so these are like rabies exposures, and there were 17 identified data elements there. Post-exposure prophylaxis has 10 data elements. Animal rabies cases has 15, and then dog rabies controls, this is population management and vaccination programs, has 12 data elements, and that's how they all align. And in the pie chart here, you can kind of see where they came from. So in green, we have ones that were original to the UAR landscape analysis. In 39, we can see, in blue, we can see the 39 data elements that came from the WHO Global Health Observatory. And 26 of those were those direct matches. Both independent reviews found the same type of data. And now what we've done, so now we have this list, but we don't want it to just live as a list. We want the list to have meaning. And so we've mapped all these data elements to the key rabies statuses or rabies recognition statuses that a country can achieve. And so we've mapped these data elements to the WHO validation criteria for the validation of elimination of dog-mediated human rabies deaths. And then the next step is the verification criteria from WHO. We've mapped it to the OIE Dog Rabies Control Program, and then the OIE Rabies Freedom Status, as well as the Unite Against Rabies Global Strategic Plan. So now you can go in and you can see these data elements. There's standard definitions behind all these data elements, but you can also see how they can help you achieve these different statuses as your rabies program improves. So there's a list, there's some definitions, we've mapped it, but that's not where we want to stop. So now where do we go from here? And I'm going to talk about a few ideas that we have. First, we really want to see countries use the WHO Global Health Observatory. So we're continuing to discuss with WHO how we can maybe merge these two lists or adopt the UAR list. They're already very similar, so that we have a consistent recommendation for international reporting of data. And again, whatever we can do as UAR to help countries identify how to participate in the WHO Global Health Observatory will be a top priority, because it doesn't matter if a list exists if nobody is collecting or reporting that information. And so that's hopefully something we can help improve in the very near future. We want to make sure this list, this document, is shareable, and so we're nearly finished with a guidance document that will have all this information clearly written out, template data collection tables, clear definitions, and that document is nearly finished and ready for distribution. And as soon as UAR's official website is live, of course, this list and the document will be made available there so that anybody can access it and reference it whenever they need to. Now, what we talked about here is an international list. And we struggled at the very beginning. I kind of showed you how we struggled with, do we address data elements from the field level, or do we address data elements at the international level? Honestly, the international level is just easier to address, since this was the first activity we were undertaking as this newly formed UAR Working Group 1. But all this data starts at the field level. And so if the field level data either isn't being collected or isn't very good, we won't expect that the national or international data is of very good quality either. So we do want to move relatively quickly into identifying ways to help improve both the standardization but also the quality of data at the field level, knowing that that will now filter up and make our international minimum data elements even more robust. Field level data collection is incredibly complex. The diagram that you see here is an example of an integrated bite case management program, which is the WHO recommended way to your gold standard for surveillance at the field level. Each of those little letters is a different area where data is collected in this IBCM system, and it is a lot. And each of those letters has numerous forms and data elements, and all of that needs to be explored, and we need to see if there is a standard, globally acceptable list of data elements at that field level. So in conclusion, we were tasked with trying to improve global rabies data and global rabies surveillance. We chose a top-down approach, largely because we are international experts. We're not at that field level right now. And honestly, it was probably the fastest thing we could do to help improve the global situation. We got together a group of international rabies experts who reviewed 12 global rabies guidance documents. Amongst these 12 documents, 61 common international data elements were identified. We compared that to the 107 data elements from the WHO Global Health Observatory, and from there settled on 72 annually reportable data elements and 24 profile elements. Again, the goal, improve global data quality and transparency, and to help improve the success of the 0 by 2030 initiative. So now that we have this list, our next steps are to produce those guidance documents for everyone listening and everyone managing rabies programs to review, and then improve the Rabies Portal in the WHO Global Health Observatory, and actually really improve the country's participation in submitting data to that observatory. And then, hopefully not too far down the line, work on a similar exercise for field level data elements, understanding that that is where our data starts. That is where we need to really be focusing support and infrastructure and getting more robust rabies investigation or rabies surveillance at that field level, which is only going to help improve the national level data and the international level data. And with that, we're going to go back to the presenters for this workshop. And I thank you very much for your time and attention.
Hello, everyone. My name is Sean Shadomy, and today I would like to share with you the work and the progress that is being made by the United Against Rabies Forum team working on rabies tools, tool evaluations, and the development of the Rabies Tool Mart. Our working team is made up of myself, along with Guillaume Convert from Boehringer Ingelheim, Andy Gibson of Mission Rabies, Daniel Horton and Joaquin Prada from the University of Surrey, Terence Scott from the Global Alliance for Rabies Control, and Ryan Wallace from the U.S. Centers for Disease Control and Prevention. First, let me start with some key questions that have been driving the work of our team. First and foremost, where are tools actually needed for rabies control programs? What are those control program activities that can be improved through the use of tools? And then what tools actually are currently available at this time to help support rabies programs? And how can rabies programs determine which tool to select for a specific purpose and which tools will actually best fit their needs? And finally, how can the visitors or members of the United Against Rabies Forum search for and find the right tools for their rabies control program activities from the toolbox that we are assembling? Tools can be used and really can truly benefit the conduct of multiple activities and aspects of rabies control programs, including the organization and the conduct of mass vaccination programs. They can be used to help organize and guide the mobile teams that are conducting the vaccination of community dogs or stray dogs or working in remote locations. They can also be used to help organize the fixed vaccination point vaccine campaigns and programs as part of an overall mass vaccination campaign. And they can be used for tracking of dogs that are vaccinated in their locations. Tools can also help support data collection and case surveillance. They can, for example, be used to help identify and track bite exposures in humans and be used for the identification and tracking of suspected and confirmed cases of rabies in animals. They can support the reporting to the national and international levels, including the notification to WHO and to OIE, as well as to regional authorities. And they can support the information exchange between the sectors. And this can be data on case detection, investigation and testing, confirmation, and ultimately reporting on both the human and animal health sides and between these sectors. Tools can also be used to help support development of strategies and conducting program planning, such as program budgeting, or estimating dog population sizes and planning dog population management activities. And tools can be used to help support community awareness raising and educational functions, such as World Rabies Day activities to generate community awareness, or school educational programs on rabies, targeting at-risk youth. And tools can help support and improve management of human bite exposures, including risk assessment, and conducting integrated bite case management. So let's look at an example of where tools can be used to support dog mass vaccination. Paper forms themselves are tools, and they can be used to record information on dog vaccinations, including identification of vaccinated dogs, the time and location of vaccination, and information on the vaccine. But without transferring that information to an electronic record, this data really cannot be used to map where the campaign has successfully vaccinated dogs, and it cannot inform or guide subsequent campaigns. So really, you need a data recording tool. We have point of interest or GPS location loggers, which can be used in a vaccinate, evaluate, and adapt model. And these tools can record the location and time of dog vaccinations. And this data can inform the next campaign, or with repeated analysis and management, the data can be used to inform and modify ongoing vaccination campaigns, although this impact may be delayed. There are also smartphone or similar digital applications that can provide more real-time tracking of locations where dogs are being vaccinated and compare that with the known dog population in its locations. And they can be used to help identify gaps or areas where those animals are not being vaccinated. And this can permit the vaccination campaign managers to provide mid-course correction and to improve the vaccination coverage by the campaign. The hypothetical mapping of ongoing vaccinations during the course of a campaign that is shown in this map helped to demonstrate the importance of using a data collection tool, any kind of electronic data collection tool, to map out the progress and to guide the campaign. Dog vaccinations on a day-by-day basis can be mapped, and this information can be analyzed against the known dog population density and locations. And areas where vaccination teams need to go to fill in gaps in that coverage can be visualized, and those locations can be sent to the teams so they can then move there next to ensure the dogs in those areas are vaccinated and that sufficient coverage is achieved. The next step in our approach has been to identify and address how to organize tools in a way that can help users to find the tools that they need. We've developed a series of high-level programmatic categories that have been informed by our assessment of the different various activities and stages in the canine rabies control program and the activities in the stepwise approach towards rabies elimination, or the SARA tool. And this is a practical planning, monitoring, and evaluation tool that's been designed to help guide rabies control programs, in which probably most viewers are familiar with. So our programmatic categories include program planning and strategy, dog vaccination implementation, education and communication, surveillance, and dog population management. And we can drill down further to identify specific activities and their purposes or themes where tools can be helpful and help improve program performance. We have identified 18 different themes as are shown here. And these themes can appear in more than one of these programmatic categories. For example, in planning and strategy, we see the themes or activities of budgeting and economic analysis, and planning and prioritization and program sustainability. When we look at dog population management, we see the themes or activities or purposes of implementation and monitoring evaluation being included, as well as planning. And planning here is an example of one of those themes or one of those purposes or activities that actually is reflected across the different program categories. So we can take a bit of a different view of these categories and the themes to see how these can be used to help identify tools to support rabies programs. Here we show some of the different themes that appear and the different programmatic categories. Again, we see that these activity themes can repeat across the main categories. For example, planning again appears as a specific activity within the categories of program planning and strategy, dog vaccination implementation, and dog population management. And this organization can help us to drill down and sort tools that can support the different activities that make up each of the program categories or areas. And they can help us to identify the tools that are available, which can help accomplish those specific activities. For instance, if I'm looking for a tool to support vaccination surveillance, and I want to know what tools are available and what do they do? Well, there are tools that may be specifically designed to do activities that just support one program category with somewhat limited applicability, such as planning and data collection, or perhaps more, such as planning and data collection and data analysis. But there are also tools that can be used for multiple categories and activities. As we see with these two examples that help to support both surveillance as well as dog vaccination activities. And so understanding this tool functionality is important for guiding selection. And with that in mind, we are working to complete mapping of the activities in the SARE and the practical work plan towards achieving rabies elimination, or the PWARE, and the tools that are available to support each of the activities in the different stages in these. For instance, we're identifying and mapping tools to the activities that are part of prevention and control, which can include tools that support surveillance, MS dog vaccination, as well as data collection and vaccination tracking, and integrated bite case management. We have additionally been working to identify the different tools that are already existing and out there and publicly available that can help to support rabies program activities. Now, it is possible to develop new tools for the job, and certainly there are a number of very successful local and national programs that have developed their own tools, but this can be really resource intensive in terms of both financial and staffing resources, so it may not be within the reach of many programs. However, there are a number of tools that are already out there and usually freely available that can be used right off the shelf to help support national programs. So far, we've identified 27 tools to include in this rabies tool mart, covering the 18 different themes or activities, as we see in the pie chart here. The activity themes with the most tools represented include data collection and monitoring and evaluation. However, there are several activity themes for which we've not identified any existing tools, and so there are still gaps where there is a need for tools to be developed that can help support those activities as part of rabies control programs. Our next part of our approach is to look at how tools can be evaluated to show which are best fit for the needs of users or which are most fit for purpose. So in 2019, a team from Partners for Rabies Prevention was working to identify criteria that could be used for objective assessment of rabies tools. And this was very similar to an ongoing effort led by FAO to evaluate tools to include in the Surveillance and Information Sharing Operational Tool, or SISOT, to support coordinated zoonotic disease surveillance. And we found that there is an 80% match between the rabies and the SISOT evaluation criteria. And so we revised the criteria and the SISOT evaluation instrument and turned it into this rabies adapted evaluation instrument or matrix called the SISOT-R. And we focused on the accessibility and the data collection and needs for the tools. And we also included as categories of criteria the ability of the tool to manage and store and to protect data, and its flexibility and ease of use, and finally, the sustainability of the tools. And we have 39 questions total within this assessment matrix across these 7 different categories. The assessment process includes a volunteer team of expert reviewers with 2 to 3 reviewers working on each tool. And their scores in these matrices are summarized so that each tool has a summary evaluation or assessment to help inform user selection. And here we see the results for the evaluation of the SARA tool. Each category or each criteria is scored on a 1 to 10 scale, with the total score provided as we see in the table on the right. And a radar or spiderweb graph is seen on the left, which helps to visualize the results for each category, which helps with comparisons. Now, the question has been asked, why should we have a scoring system? Now, definitely this scoring is not meant to be used to help claim that any one tool is better universally or better than any one other tool. However, the use of an assessment and scoring system can help to provide a way to standardize criteria to assess fit for use or fit for purpose for tools across the board. And it can also be a way for users to help determine which tools might best fill the gaps in their rabies control programs and infrastructure when they start looking at specific criteria that are most particularly important to them. Finally, the tool, this instrument, this assessment can be used as a way for developers to evaluate and to improve their tools. The SISA evaluation instrument permits comparison of the strengths of the different tools, and the instrument uses criteria that are independent of the design of the purpose of the tool to evaluate how the tool may work in the hands of the users. However, it is important to remember that the purpose of the tool and the intent behind the development are important in informing tool choices. Sometimes the scores may show some differences in the overall assessment of different tools, but on the individual category scores, they wind up being quite similar. For instance, when we look at tools that can be used for planning, such as the Global Dog Rabies Elimination Pathway, or GDREP, and the Canine Vaccine Calculator, or VaxPlan, the total score of one tool may be a few points higher than the other, but when we look across each of the 7 evaluation criteria, the scores are actually quite close, and they suggest that the utility of the tools in the hands of the user may be very similar, and therefore we need to look at the specific detailed functionality of each tool to help inform the final selection. Sometimes the overall scores can be similar, but the tools may have very different strengths drawn out by the difference in their individual criteria category scores. When we look, for example, at tools that can be used for monitoring and evaluation. And here, for an example, we have the SARE and the Rabies Epidemiological Bulletin, the REB. We see that the total scores are very close, but the score in one category may be much different than the other. Here for the SARE and the REB, that is with the flexibility of the tool. And this may indicate that one tool may be more advantageous than the other for users in this particular activity. So let's look at how these evaluation scores and radar graphs might be used. This graphic shows a wiring diagram or schematic for rabies surveillance in both the animal health, the human health, and the environmental health sectors, starting at the left at the point of event detection. The information flow from left to right is on case detection, investigation and confirmation, and ultimately reporting on both the human and the animal health sides. And between these sectors, going from identification at the local level to reporting at the subnational, national, and eventually the international level, where notification to OIE and WHO takes place. When we look for where tools may be helpful or needed, there are a number of different nodes where data is collected or data is managed and analyzed, or it's shared at every level from the community level up through the subnational, national, and international levels. When we focus on surveillance at the local or the community level, here we need tools that are focused on data collection and management in the hands of the user. And so the tools that are used here will need to have high scores in these areas and also provide strong data storage and protection, as we see reflected in this radar chart. This is where we will find tools such as the vaccination data loggers and tools for rabies case surveillance and integrated by case management. Conversely, when we look for tools that can be used to support surveillance activities at the national and international levels, the primary need is for tools which are capable of digesting and managing and analyzing and sharing or transmitting that data. And therefore, we will be looking for tools that reflect this different set of strengths. Finally, we are working to address how to give members of the rabies community the ability to search for and find the right tools for their control program activities within this rabies toolmart. And here I'd like to hand you over to my colleague, Andy Gibson, who will give a demonstration of our ongoing work in that area. Thank you.
This is a concept build of functionality we hope to be able to provide through the UAR website under a section specifically for tools to support rabies control programs. We currently have this working title of Rabies Toolmart or Toolmart. The objective is to help those implementing rabies control initiatives to easily find the most suitable tools to support their efforts. As Sean has mentioned, there are many tools out there which benefit different aspects of rabies control programs. So the idea is to provide a simple and intuitive way to present all the tools that have been evaluated by the UAR. To be clear, what you're about to see is entirely a mock-up just using the current UAR website styling. It's intended to stimulate discussion and feedback on what the system could look like so that the structure can be refined, and building of the actual system hasn't even begun yet. We anticipate that the Toolmart section could be navigated to from the home page, such as up here in the header bar, and this would take you to a simple landing page. From here, you could either choose to view all the tools listed in the system in one big table, or navigate by programmatic categories according to what the tools are used for. For now, let's go to the full list. And here we can scroll through a table of all the tools that have been reviewed by UAR. At the top, it's possible to filter the table to only show tools in a specific category or that are available in a particular language. In this table, we could also see some basic information about each tool, such as who the provider is, which programmatic categories the tool contributes to, the CISOT score, and perhaps a mean user star rating. You could then click on a particular tool to navigate to a page all about it. Every tool would have its own page, but they'd all have the same structure to make it easy to review and compare tools. And the information on these pages could include links to the tool's external website, a more detailed description, perhaps a video explainer giving an overview of the tool, information from the CISOT evaluation, such as a breakdown of the specific scores or the spider diagram, and finally any peer review publications that refer to that tool. Let's jump back to the Toolmark landing page and review the tools in a different way. The tool category section is intended to make it easy to review the tools according to the specific component or stage of rabies control that you are interested in. If we go into a particular category, such as dog vaccination, we're then presented with a further breakdown of themes. These are specific areas of work within that category. For example, in dog vaccination, there are aspects of campaign planning, data collection, vaccine banks, and so on. When we click on a theme, we then see all the tools that have been tagged as being useful in that area. Tools may give support in one or more areas, and so can be tagged under multiple themes, as we can see in this example with the GDREP and VaxPlan tools appearing under both planning and budgeting themes. Again, from here we can click on any particular tool and see its homepage as before. We would really appreciate any feedback about this concept, whether it's something that you would find useful and how you think it could be improved. Thank you very much.
All right. Well, many thanks for those presentations, Ryan and the team. We have got a few minutes to take a few questions. Please do remember to write your question on the question and answer place on the chat. A number of the questions that have been put here have been answered, so you could look at the answers that have been provided there. Please let's keep on it. I have one question here though that that was addressed to Peter about rabies and rinderpest. That one is a zoonosis, the other is not. And I know Bernadette answered partly that question. I'd like you, Bernadette, to just take a moment and tell us why we are focusing not on rabies eradication, but on rabies elimination. And then I'll ask Peter what kind of, what are the similarities that you've got with this? Please go ahead, Bernadette.
So eradication means removing the pathogen from the face of the earth, as was done with rinderpest. Small stocks are kept in high, secure laboratories, I believe. So with rabies, this is not possible. We will be able to remove rabies vaccine virus from dogs and stop transmission through vaccine use in dogs and protecting humans after a bite with post-exposure prophylaxis. But we will never be able to remove rabies virus from all around the world. That's a simple answer. I pass it over to Peter.
Thank you. I think that really helps to have clarity at what's the goal for the rabies elimination target of 2030. Peter, does the zoonotic nature of rabies elimination make it much more difficult or simple compared to rinderpest?
Yes, I think both actually. I think it's in some ways it could help you because because people are infected, then you get a much better ability to report and see where the disease is. So I think that helps greatly, because one of our problems was that people, particularly when we had the low virulent strains of rinderpest virus, they were not reported well because farmers didn't consider that they were of great importance. And in fact, they actually wanted them because, like in Ethiopia, there was one called Desta Wutet, was a name used to describe low virulent rinderpest virus, which meant milk rinderpest, because by vaccinating calves, naturally circulating virus was protecting them later against the infection. So it's you know, a double-edged sword, really. What did you want? That's what you wanted me to say, wasn't it? You wanted me to answer?
Yes, that was the question, and many thanks for that answer, Peter. There's a follow-up question here, which I would like to ask our colleagues from the OIE to answer. That you, Peter, in your talk, you highlighted a very important component of rabies control, which is the quality of rabies vaccines, especially animal rabies vaccines. So what strategies do the UAR, the United Against Rabies, plan to implement to address this? So I'll ask my colleague, if Gregorio is on, or Rachel, to help us with an answer on that.
Hi, so Gregorio is not actually on, but I'm happy to kind of talk about, so firstly, in terms of the Oie Vaccine Bank, certainly we're looking at promoting that as a means of ensuring that, thanks. So in terms of ensuring that countries have access to high quality vaccines and making sure that they've promoting that intergovernmental standards, absolutely, that's one aspect. And I think the important aspect also that we're looking at is engaging private sector, so engaging pharmaceutical companies, engaging the private sector into the United Against Rabies Forum, so that we're having those, so that we can then kind of link all of these things together and just make sure that we're promoting that standard and passing that that quality on to countries.
Thank you, Rachel. Bernadette, do you have something to add on that?
No, I think, Rachel, I would have piped in. The vaccine bank does assess the quality of the dossiers that comes in based on multiple criteria, and you know, immunological response, duration of response, and all of this. And so the vaccine bank has assured quality and safe vaccines. But a lot of vaccines, dog vaccines used in many countries are actually either locally produced, and there the challenge is much bigger to have an overview of the quality. So it is something we do keep an eye on. And one additional thing is WHO piggybacks on the Oie Vaccine Bank. So if countries want to procure the vaccine via the Ministry of Health and via the WHO, they can do that using the same negotiation and the vaccine bank negotiated terms of Oie. Thank you.
Thanks, Bernadette. There's a question from Mary Warrell regarding that there is no discussion yet on who will pay for these rabies interventions. I think there's a good answer for that. But also she mentions that the Gavi plan to finance rabies PEP has been postponed and health workers are diverted to deal with the pandemic. Veterinarians and others are also involved with dog vaccination, are less involved with COVID. So this is an opportunity to evoke the One Health concept by WHO and Gavi, coordinating with the OIE. So mass dog vaccinations could have a greater effect on humans' mortality than trying to provide PEP in Africa. Do you think that diverting the Gavi funds allocated to rabies to provide dog vaccination will be possible? I think that I'll let that question be answered partly by Bernadette and my colleagues on the panel. So Bernadette.
So it was already a big struggle, I would say, to get Gavi to take rabies on in its investment strategy. Professor Worrell brings up a good point on trying to scale up the dog vaccination campaigns. That is really where we need to put our focus on. And we spoke about focus early in our discussion. This is where we need the investments to take place and the use of the workforce to really scale up dog vaccination. The decision about Gavi, reprogramming its investment to dog rabies vaccine is not something I can speak to. In the past, this was not something Gavi felt that was within their mandate. But I think OIE has this opportunity as of the vaccine bank, and if we could scale that up and get countries to either use it as a catalyst or to procure their own vaccines, this could be a way of having a parallel type of a complementary program where Gavi, once it kicks in the investment to rabies, a human vaccine rollout, could also be doing a scale-up job on the dog vaccine campaign rollout. That's it for me, Tom.
Thank you. About discussions on who will pay for these rabies interventions, I'll ask Ryan to just provide a little bit of information about Working Group 3, which is geared towards answering that specific question.
Yeah, thanks, Thumbi. I don't have much to add other than we do have a working group that is specifically trying to address the lack of coordination amongst all these different sectors and objectives. We have surveillance issues, we have human vaccine issues, dog vaccine issues, population management issues, and I would say there's no single entity that has either the funding or expertise to tackle all of those issues at once. And so Working Group 3 is trying to find out where those international and national entities exist that can participate and where that funding might come from. And quite honestly, it will need to be a combination of in-country support, but probably if we look at other global examples of disease elimination or eradication, the international community needs to rally around this and support this as well. But our work group 1 is very much in the weeds, trying to help those field level issues. A whole different group of rabies experts are specifically trying to address that very complicated issue.
Thanks, Ryan. And then you've got a question from Mohammed and Dewi. They're all connected to the rapid tests for rabies. Are they commercially available? Are they already on the market?
Yeah, I am going to avoid saying any particular manufacturer's name because none of them are recognized by WHO or OIE as a primary or confirmatory diagnostic test. There is one, and you can see it in several publications just in the last few years, that looks like it might be pretty good, and we're excited about it. But the studies are small, and they're not covering. They're not done in the way that we would expect to see them done to get like an OIE recognition status. And so one of our activities as Working Group 1 is to both work with the groups that are already piloting these in the field, and identify other opportunities to pilot these in the field in a much more coordinated manner. So our sample size is much larger. We can see how it performs in numerous settings across numerous species and multiple rabies virus variants. So we can provide you with a much better evidence-based answer on which of these lateral flow assays or RDTs are likely to help out your surveillance and IBCM programs.
Thank you. And I'll ask Professor Thomas Muller to also speak about oral rabies vaccines. Are they a tool that we are to use for rabies elimination? What are your thoughts?
Yes, of course. Oral rabies vaccines are definitely a tool to combat rabies, in particular if they are used in combination with parenteral vaccines. WHO and OIE have recently endorsed the use of oral rabies vaccines as a complementary tool to mass dog vaccination campaigns. But of course, this needs to be underscored by immunogenicity studies, field trials, and last but not least, we should keep in mind that all rabies vaccines need to meet safety and efficacy standards according to international criteria, and need to get licensed for this kind of purpose.
Thank you, Thomas. I'm afraid time is up for our discussion, and it's really exciting to have all of you joining on this webinar series. We have another webinar series coming, another webinar happening at time as now next week. But before then, we have one more treat for you. One of the big risks for anyone working with control of rabies is, of course, how we handle dogs. So we have asked Daniel Stewart, some of you might know him, an amazing South African trainer and animal behaviorist who works a lot on rabies campaigns, to share his top tips on safe dog handling with us. Enjoy.
Hi, I'm Daniel Stewart from South Africa. I'm an animal behaviorist, and I train people. You thought I was going to say dogs. But what I specialize in is rabies elimination. One of the biggest risks that we come around running rabies vaccination campaigns is actually being bitten. And by understanding the behavior, the dog language, that is what actually makes us safe to prevent such dog bites. So here in South Africa, we have a variety of different living kind of conditions for dogs, urban, and you've got rural or peri-rural area where the dogs are free. They're either being bred for a certain reason, but they are free around the village. Those people we have to go to because there's no ways of them bringing in the dogs to us. We must understand that when we come into any area that we're not familiar with, we are strangers. And the dogs will respond negatively a lot of the time to strangers. So we need to look at those body languages, those body postures, the little subtleties of how the dog is actually talking to us before we approach, from a safety point of view. The tail, everybody comes along and goes, wagging tail means a happy dog. Not always, but especially if the tail is tucked between the legs, the dog is scared. Be careful of that. A lot of these dogs around here are not aggressive. They're just defensive. They don't know who you are. You're a stranger. Make sure you become friends with these animals. So when I approach a more aggressive dog, or the dog is showing aggression towards me, I use my hat a lot, that's why I wear one, is that I offer the hat. There's a lot of scent in my hat, and the dog would rather sniff that. If, which it has happened before, that the dog is aggressive, the dog will take the hat out of my hand, and it saves my hand from being bitten. So to have a successful rabies campaign, you need a couple of things. You need a champion, somebody who can have enthusiasm, who engages with the community, who is really passionate about the project, especially when it comes down to understanding the culture and the social conditions, really, of what these people live in and what the dogs live in. Majority of the people that realize the severity of rabies. And again, that is so important about coming into a community like this and actually educating them. And when we're talking about education, we're talking about educating the children. Educating the children not to be nasty to dogs, how to be able to handle the dogs, how to actually approach them, how not to get bitten by them. That is going to stop rabies in people. So what we as a rabies fraternity really have done already, and it's been across the world, and there's a number of different publications that we've tried to create, is that we've got booklets, we've got online education programs, but we've found in this rural kind of setting is that a small booklet in 2 different languages really help. The booklet itself, we've got a comic format, so it's friendly, it's fun, even the children can actually color it in because it's all in black and white. Or we've got another booklet which is very factual. What to do if you get bitten, how to prevent yourself being bitten, because education is the key to success. I hope by 2030, no one will ever die of rabies again. And we can do it by working together and understanding dogs' behavior and treating them kindly. If you can avoid getting bitten, you can avoid getting rabies.
Thank you, everybody, for joining us this morning, or maybe your afternoon. Sun's just coming up here in the US, Ryan. We heard from great presenters. We had a great discussion. I really want to thank Bernadette and Peter, our speakers, Terence and Sean and Andy, and then Daniel for providing that really inspirational video at the end there. Don't forget that there's another webinar next Monday, same time, and you'll hear from our working group 2. Got a little sneak peek from Thomas today, but I'm sure you'll hear more from him next week as well. And then also we had quite a few questions or comments about how you can participate or how you can find out about rabies activities near you. Just reach out to the UAR Global Rabies Coordinator, who I think that information has been shared. If not, maybe someone can put it in the chat box. But they'll gladly connect you to the working group leads that you're interested in working with, or to any of our partners in the field that may be working in an area where you're interested in. And so with that, we are just about at time. And again, just want to say thank you to our coordinators, thank you to all our presenters, and thank you to the well over 200 people that joined us this morning. It was really great to hear these questions and hear these great videos. Thank you, everybody. Bye.